We educate women, they create the demand, and now the change happens amongst peers because they're forced to.
Better sex and what that means. And that's what gynecologists typically are not talking about. And I am lucky enough to have Dr. Michael Reid in front of me, who is a cosmetic gynecologist.
We are a group of physicians that are well informed, well intentioned, and ready to answer questions for the modern day woman.
I love that. I love that. Because when we think of gynecology, and I kind of talked about, like, we're almost thinking about, we've trained medical, the
Yeah.
traditional medical,
Yeah.
and then therefore patients about the reproductive system, where it's
Absolutely.
almost about reproduction, either prevention of,
Yeah.
support of, or disease management.
Exactly. That's it.
And that's it. And yesterday we talked about the 4 pillars. I kind of looked at it more like that's the reproductive system, and then there's the female sex system, but that's your 4th pillar.
Same thing. We're
Essentially.
speaking the same
Yeah,
language.
we just had a slightly different twist on it, but it's the 4th pillar for
It
you.
is, yeah.
Where it's like better sex and what that means. And that's what gynecologists typically are not talking about.
Yeah, I think of it as just like this giant sleeping giant has been pushed around for 20 years and said, oh, and is waking up. And that's
Yes.
women's sexual health and the voice of women to be able to finally step out. I like to say in the playing field, you know, women have been on the sidelines. They haven't been in the playing field, scoring touchdowns, hitting home runs. They haven't had that opportunity. And that is what is coming now. We're coming on in.
And we're just starting, I think, because I think that there's like, we're seeing it in our practice. And again, I don't do surgical. We do, non-surgical options. And so, but the issue is that there's a movement happening in women for sure.
Yeah.
Obviously they want to feel better. That's the hormonal movement. And we're seeing a lot of that in perimenopause, menopause, and lots of influencers out there talking, but they're not yet talking about sex. Women are, but we're kind of still a little bit behind with medical. You're not. And so that's where, again, now this movement is going to have an influx of people into your practice wanting better sex.
Yeah.
Because they feel better. Like you said, the giant is awake.
Yep.
And now they want to have better sex. And
Absolutely.
they know that they deserve better sex.
They deserve it.
Yeah.
Part of life.
What made you want to do the documentary?
In my practice, 99.7% of the women that come in, they're coming in on their own volition. They want these things for themselves. There are some misconceptions. People feel like what we're doing has no functional attributes to its treatment. They think it's only cosmetic type treatments, but it's actually a combination of both. Because of that, as well as the lack of education amongst physicians, meaning my peers, the education isn't there. Our peers are not pushing the envelope to answer the modern day woman's question. And so the strategy in my mind was to say, let's bypass my peers and let's educate the woman. We educate women, they create the demand, and now the change happens amongst peers because they're forced to. And so that was the idea behind the documentary.
Brilliant. Absolutely brilliant. Because even the more I think about it, not related specifically to cosmetic gynecology, but I think that there's the institution of medicine that's gotten huge, but then there's governmental, and then there's big pharma. And the more that gets big and rigid and doesn't change, it keeps us 20 years behind. And then the innovators, such as yourself, are with the patients that are more proactive than medicine. They're looking for solutions, and you're an innovator providing solutions. And so again, I see a lot of influencers just in the hormonal space trying to change the system.
Yeah,
But
they are
instead,
changing.
you just went right for the patient. And then, because what's happening with the hormones is the reason the system got reactive and lifted the black box is because the patients were pushing for it.
Exactly.
But you're actually even bypassing the system. You're going to get the proactive patients and then just get others in your field to start talking more about it. And
I think
providing
with the
solutions.
documentary, they'll understand that there's 60, 70 of us in the United States. We're sprinkled all throughout several states. It might be a little bit more than I would say 60 to 70. But then they'll begin to understand that these people live in my backyard.
Yes.
I don't have to travel to Beverly Hills. I don't have to go down to Washington, D.C. There's somebody right here in Iowa that I can see to help me.
Yeah, I don't have to go out of the country.
Exactly.
Yeah.
So we are educating the nation with this. We're educating half the population and trying to get half the population back on the playing field.
I love this. Love this because you just bypassed it. Because again, I think that as I see the influencers and hormones try and change the system, and I keep thinking that, like, even for me, which I do hormone, like hormones are the key, so hormone replacement, and we've been filling the gap. And but why bother wasting time and energy trying to change the system? Instead, just filling the gap for patients and getting other providers that fill the gap is like the way to do it. And then the patients know about you. So I love it. So what are you finding on your documentary with your patient experiences that, because there's probably some unique things that come out because you're doing multiple different patients and they're kind of thinking and their emotions behind why they're pursuing certain surgeries,
Yep.
right?
So that other women can understand that what they're thinking, they're not crazy. Other people are thinking the same thing. And guess what? There's treatments and answers for what you're thinking about.
Yeah.
And so this is all that it's about. And if we get that ball rolling, that ball ain't stopping.
No, not at all. Not at all. No, and do you find that women are real open about it?
Well, I got the right women on the documentary that are willing to talk about it. So I got the right women on the right bus to
Good.
get us there.
I think it's just a matter of finding the woman that's like open to talking about it. It
That's
doesn't
it.
have to be all of them, but you
Yep.
just need a few. How many women have you?
So we talk the stories of vaginoplasty. We talk the stories of lichen sclerosis. We talk the story of orgasm. We talk about the story of lack of education amongst physicians. We talk about the story of pelvic floor physical therapy and its benefits. And that's a lot already. And then sharing those stories and how the treatments are done and what the before and what the after looks like.
Okay. Wow. And so what are the different surgeries that you do? And what are like the most common things that women come in wanting to see corrected?
Well, there's a whole host of things. You know, they all want improved sexual function. So, what does that mean? It means something different to each woman. And so, if you were to lump the procedures, you would say labiaplasty, where we actually reduce the inner lips. That cohort of women can be anywhere around the 20s to mid 30s on average. Then, if you talk about vaginal tightening, where maybe the woman doesn't like the way it looks open after having a couple children, or she's lost the ability to kind of grip when she wants to, or tampons are falling out, or audible noises are being made, and she doesn't want to feel that or hear that, but she would like to feel is her partner again. And so that group of women tend to be in their 40s because they've had children. And so that larger cohort can be anywhere from the 40s to 50s, right in that range. Labia majoroplasty, that's where we kind of modify the outer lips, just like our jowls as we age and droop. Well, our labia majora droop a little bit and they don't like it. And it's uncomfortable. And now they're pulling and tugging on something. They hadn't been tugging on something. I'm used to pulling and tugging on something, but she isn't. And so she doesn't want to feel this way anymore. And most of the time they have looked around trying to figure out where they can find something to be done. They ask their OBGYN, well, I don't know what can be done. That's cosmetic. And then that's how they find. So that's another procedure, but that's usually women in their later 40s and on. Here's would be clitoral unhooding that we do for lichen sclerosis, which is a really difficult skin disease. And so we are able to manage that because that skin disease can block the clitoris and prevent access to pleasure. And so clitoral unhooding is done so that we can get back to pleasure and open it. So those are some of the procedures. We do some of the non-invasives. You know that. You're just a warrior as well, like we are as far as
I only
women's
have the
sexual. There
non-surgical
you go.
ones. Yeah,
And
but
so,
yeah. What else do you do to like enhance those results with surgery?
I try to optimize healing, post-operative healing. So I will use platelet-rich plasma. I'll use CO2 lift V. I'll use old medicines like dexamethasone or old treatments like ice
Yeah.
and that kind of stuff.
Okay.
Yeah.
Look at it. You want to jump in? Oh, well, you should just say hello then instead.
yeah,
We're
say
doing a
hello.
little podcast. Yes.
Hello, people.
So this is Dr. Marco Pelosi, and he is the founder and the reason why the International Society of Cosmetic Gynecology exists.
He
Him and his
brings
dad, and
he brings
yes,
all the people, all the physicians from around the world, including the United States, to come together. And what happens is steel sharpens steel. And this is the man that started all.
yes,
Marco Pelosi.
Well, it's a pleasure to be here and a pleasure to
Yes.
meet like-minded people who
Yeah.
listen to women.
yes, yeah.
All right, I gotta go listen to some more women. I'll be back.
All right. Tell me a little bit about your practice and where it's located so that people that are listening that want services know about it. And I also, again, this weekend have learned a ton because I don't do surgical options, but I am surrounded by all of the best in the world. And so now when people do come to us and there's things, and again, lichen is one of those big things that patients come in and I don't have options for that and nothing. So anyhow, tell us about your practice so they can look for you. In addition to Private Parts is the documentary that he's doing, and it's not yet out, but
Right,
it's
right.
going to be out on what?
We hope to get it on Netflix, but it will be on a streaming platform. And we're
Okay.
hoping by August.
All right.
Yeah.
Wow. Do you have a whole production team with that?
Well, actually, I use Serena DC. She's
Okay.
a production company in Beverly Hills.
Okay.
And so she's done some other documentaries. And so we chose to use her.
I love that.
And that's who we're using.
I
DC
love
Serena.
it.
It was 3 days, a day up in Davis, and then 2 days down in LA, Beverly Hills. What we started off by just talking about like why I did it. At first, it wasn't. I wasn't thinking about. I thought I was doing everything okay. Shoot, I thought I was a damn good OBGYN. And I prided myself on, hey, I'm really taking care of women. And so I didn't think I was doing anything wrong. But then I had my personal thing, right? My personal thing was I was 340 pounds and I had just remarried and we were getting ready to have a child. And I'm looking at myself being 340 pounds. I got to do something. I ain't going to be around. And so then I did a gastric sleeve and lost a whole bunch of weight. Then I was heard about some testosterone. So I was like, damn, I could go there or I could go there. So I picked the one I wanted and I felt better that way.
Wow.
Then I had skin. So then I said, shit, I got to get rid of this. I'll go ahead and get a tummy tuck. And then now I'm feeling really good. And I'm feeling like, wow, I got a whole lot of options and I got better quickly. And I'm taking care of women. And I realized, shit, I'm not doing as good as I should be because I never asked my patient, well, how's sex? How's life? What are you feeling? What are the real things that bother you? You know, there's undertones. You know, they come in with complaints of a pelvic pain, maybe, but that pelvic pain may have some relationship issues. It may be related to support issues. It could be tissue problems. And so if you're not thinking in your system or in your pillar, you don't pick that up. And so anyway, I went and got some training. And then I came back, got some more training. Then I got a NAM certified provider, got some more training. And then I ended up working with Michael Goodman. He wrote the first textbook in female cosmetic gynecology. So then I did a 18-month fellowship with him, like an apprenticeship. So I was with him with every single patient, every single consultation, every post-op patient, every phone call. And so it was like a residency. So I was able to, like a true fellowship. So
Okay.
in the United States, or in the world, no one's had as much training as I have had in this field. No one does. No one, hands down, no one does. That turned into this fire that took off. My wife and our 3 children, we moved from Omaha, Nebraska. And, we were physicians, so we had a 5,500 square foot home with a 20 by 20 pool in the back, all of that. And we moved to Davis and we moved into a 1,400 square foot home. We rented and we stayed in this little thing for about 3 years in order to be able to get the education, we had to live smaller. And with that, I even traveled to Dubai, India, the Philippines, teaching this stuff that I just fell in love with.
Now we're passionate. It's a
Yeah.
passion.
And so that's kind of my background and where I got.
Like lifelong learning and a
Yeah.
passion for it,
Yeah.
and then teaching others too.
Yeah.
Yeah.
And then we're going to change the landscape for women because we
Yeah.
are going to end up with a fellowship.
Oh,
Because
all right.
we're going to do
Yeah.
it. It's going to
It
happen.
has to.
We got plenty of educated people in this world. They just have to understand that we have 440 million people in this country. 200,
Yeah, right around 300. Because
300
there's like half women and like, half of them are, again.
are women.
Yeah.
So
yeah.
once we
And
decide to put them
Yeah.
first and go from a destable relationship to a stable relationship, woo,
I said that there's
make
like,
America great again.
and making vaginas great again too, right? So yeah, do we have,
Here,
yeah.
please do.
yeah. Do we have the hat, making
I could do
vaginas
that.
great again? So I think it's interesting. The reason I say that is because I like pulled the stats for even women and hormones, and basically 300 million in the US, a little over half are women, and a little over half of that, 75%, are either perimenopause or menopause. And so there's a hormone issue, and
Yeah.
obviously not feeling
Absolutely.
well. But we actually learn more about treating cardiovascular disease than we do. And that 75 million also have sexual complaints. And so again,
Absolutely.
like what a significant portion of women, right? So
Right.
but we were saying that he's been passionate about learning and teaching others, and we're getting a fellowship at some point on cosmetic gynecology,
We're going to
right?
have to, yeah.
And this is because
And then this is such a great term here, making vaginas great again.
that was such a good marketing
Yes,
thing.
we are.
So we did our first non-surgical with that 4V. Dr. Garveria, who speaks here, had taught us that laser treatment. We did it on the face for a facelift.
Yeah.
And he's like, you can do it on the vagina. Again, I don't do surgical options. So that gave us, and again, these are women that aren't coming to me for surgical options. But once they realize, and I did 20 years of ER and saw lots of vaginas with pelvic exams, and I thought they're all different, but never once did I think they had to look pretty or, it wasn't, that's also not why they were seeing me right then. Different for you. But then once you realize you can, then once they realize they can, then, so that's how we ended up. We're like, how do we end up promoting it? It's hard to do on social media, and they're not looking to come to us for surgical. So they weren't specifically looking. So we just did an event, and this became a great marketing tool for it. Because again, it does capture the making vaginas great again, even
That's
though
right.
technicality, I had one doctor stand up and say, it's not the vagina, it's the vulva. And I was like, but women know what we're talking about, right?
Yeah,
So
yeah.
anyhow, we get lost in technicalities. Like you said, they come in for one thing, and we just have to find out what that one thing really means so that we know what kind of results they want, because otherwise we're not going to make them happy. So, but yeah, we don't need to talk in technicalities, right?
No, we're just having
Not to
fun. I think
patients,
people understand, but
yeah.
as long as we educate the patients.
Correct. No, absolutely. For sure. But so it sounds like you're passionate about learning, and you did fellowship after fellowship, and even beyond. But there is so right now for gynecology, just so you really are going, when you're going to do those they're almost additional trainings and certifications, but not an actual, duration 2 or 3 year fellowship.
Yeah, no, these are the prior to the 18 months that I did. Any training that anyone's getting is a weekend warrior, 3 to 5 days of training.
Okay.
Which is not, that's better than zero training.
Wow.
But 3 to 5 days can make a significant impact. You're going to move slower and you learn as you go.
Yeah.
That's why they say medical, for whatever reason, they call it practice, right?
Yeah.
A medical practice.
Yeah.
Because you are practicing what you know, but then as you practice what you know, you get better. So then now you've gotten better. So now you're practicing what you know again at a level, and then you learning more, you get better. So that's what they mean by practice, I think, and that you're elevating, but you got to start somewhere.
And you are the definition of delayed gratification too.
Absolutely.
So yeah, I don't think that people think enough about like what physicians go through. because they
Yeah.
give up a lot of time and money, and they don't even think about that, because it's all about passion, but you give up years, like sometimes 12, 15 years
Yeah.
before you actually are out and making money in some way. So delayed gratification, but you gave up a lot just to go back and get more education
Absolutely.
again after. So I love that. I have a huge amount of respect for innovators. I think that healthcare is going to be owned by, physicians that are pushing the envelope and innovating, and that's you.
Well, I love
So
that.
tell us a little bit about your practice real quick so patients will be able to
Practice real
find
quick.
you.
So my practice
It
is
doesn't have to be real quick,
okay.
but yeah.
My practice is located in Davis, California, which is Sacramento. So if you're flying in, you want to go to Sacramento International Airport. You can also come in from San Francisco. But then you can also visit me in the LA area. I'm in Beverly Hills in the Golden Triangle, right on Brighton Way. So
Okay.
a couple streets over from Rodeo. And if you're going to fly in there, I always suggest do Burbank because it's easier. But you can do LAX.
Perfect.
And the
Awesome.
other cool thing that I want to tell you is that our practice, and I say ours because it's my wife and I's practice. She's a nurse, and so she does medical office. She's a patient advocate. She does just about everything. She's like my right hand.
She does it all.
Yeah, so it's a great practice. It's a great feel,
It's a family environment.
and it's family,
Yeah.
and you just know that we care about you.
Oh,
You
I
just
love
know
that.
it.
I love
Yeah.
that. Dr. Michael Reid, thank you so
Yeah.
much for
Thanks
being
for
with
having
me
me.
today. Yes, I'm so glad we connected.
Appreciate
All
it.
right. If
All right.
you have any questions, you know where to find them. Start some conversations in the comments.